When it comes to heart health, we also need to keep in mind the connection between our hearts and our minds. And this morning, cardiologist Dr. Shoba joins us to discuss in depth the importance of the mind-heart connection. Good morning, Doc.
Good morning.
How are you doing today?
Good to be here.
Good, good. It's a lot of connection there. You know, your mind, your heart, you got to have both to maintain good health. Got to have both to be alive. So you got to take care of both of them.
That is very true. And you know, if we have negative feelings and negative thoughts and our emotions, it really adversely impacts not only our heart, but our whole body. You know, for example, one of the biggest negative psychological factors that we have is depression.
Right. And so many people are being treated for depression.
Yes, it's very common and it's actually unrecognized.
Right.
And when we are depressed, we don't eat right, we have loneliness, you know, we have social isolation, and we don't get ourselves checked for medical issues, we don't take our medications correctly, blood sugars go uncontrolled because we are just not eating right. And actually it's been shown that depression is very well linked to heart disease, not only as a causation, you know, it may be a factor that actually increases our risk for having heart disease. However, we've also noticed that people who've had a heart attack, who've had bypass surgery, if they are depressed, they take longer to recover. They have recurrent events. So depression is not good for the heart, not good for our whole body actually. Anger.
Yes.
Think about anger.
Yes.
In fact, anger and hostility, you know, that in fact, they've found for up to 2 hours after you have an angry outburst, you are at higher risk for a heart attack.
For 2 hours?
Yes, yes.
Wow.
Some studies have shown that. And so anger increases our bad negative hormones. You know, it causes spasms in our heart arteries, blood pressure shoots up. Loneliness and social isolation is actually not good, not good just for the heart, but for our whole body too.
Right.
And you know, we saw that in COVID times. Stress and anxiety. You know, stress, we've talked about it before, it can even cause a condition called broken heart syndrome. It can cause a big heart attack. Anxiety can raise our heart rate, our blood pressure. It can increase the spasms in our heart arteries, PTSD. So some of these things, all these factors that are emotionally, if we are not able to control it, it can adversely affect our heart and our whole body.
If you're feeling any of the symptoms of depression or anger or any of those emotions that we were talking about, it's important to seek out help, professional help.
Yes, it's very important to seek out professional help because it's hurting you.
Right.
It's hurting you.
And that connection between our emotions, our mind, our heart, you know, we say we feel so much with our heart. And for a lot of folks we do. And, you know, you've just got to take care of both areas. And
absolutely.
If you take care of one, it's going to take care of the other.
Absolutely. Very well said.
And I love the fact that, you know, people are so easy to anger. And it's hard sometimes to turn that anger off, but you really need to for your overall health.
For your overall health.
And stress, we could talk about stress,
stress
for hours.
Hours, that's right,
Yes,
that's
so
right.
Dealing with that as well. Maybe we'll talk about that next time.
We should.
All right, Dr. Shoba, thank you so much. Great advice. We appreciate you so much. If you want to find out more, go to heart.org for more information.